We don't have to be spending money on a billion fancy tests because we have a lot right at our fingertips. And the next test I think everybody has to do is a cardiometabolic profile. And this is beyond just lipids. It's not just your cholesterol, your HDL, your LDL, and your triglycerides. Those are the standard tests that everybody looks at. But we need more. That high cholesterol means very little. Some HDLs are good, some are bad, some LDLs are good, some are bad. What really matters is the apolipoprotein B, and even more importantly, to me, is the apolipoprotein B to A ratio. So think about apolipoprotein B as the liver is making cholesterol. It's where most of your cholesterol comes from, guys, not from your diet. Most of it comes from the liver. And the apolipoprotein B is a protein that binds to cholesterol to carry it places. And simplistically, I like to think about, okay, it's like a little delivery driver that's driving the cholesterol to where it needs to go. But there's a whole bunch of ApoB, and it's delivered all its packages. It's just going to leave the packages in the arteries. ApoA is going to pick it up, recycle it back to the liver. So if the ratio of B to A is less than 0.5, probably you're in pretty good shape. Now, if you have a super elevated ApoB, that still may be a problem. But in general, if that B to A ratio is good, then cardiovascular health is probably going to be okay. The exception is going to be my people who have an Lp(a). And this is another test that everybody needs. You might only need it once, because if it's normal, it's not going to ever be abnormal. This is a genetic problem. You inherited a gene that makes too much of the lipoprotein (a). And this is a lipoprotein, again, makes all of your ApoB a little denser, a little heavier, a little stickier, a little bit more dangerous. You have to know at least once what your Lp(a) is. If it's normal, you probably don't ever need to check it again. It means you don't carry that bad gene. If it's high, we can follow it to see if we can modify it. We don't have a great ways to modify it, but there are some things that work, at least a little bit. For instance, for us, 1-methylnicotinamide, 1-MNA has shown some really nice results in reducing Lp(a)s. And there's going to be some other drugs in the future that are going to be working on this too. I think those absolutely have to be tested. I like to include in that cardiac panel looking at things like what's called Lp(PLA2, amyloperoxidase, oxidized LDLs, and highly sensitive C-reactive protein. Because these are inflammatory markers. These are markers that tell us there's vascular inflammation. And there can be vascular inflammation independent of your cholesterol. Cholesterol may be great, and there's vascular inflammatory factors. So I like to include those. But if I have to narrow it down, then getting those lipid profiles is much more important. And then the highest sensitive C-reactive protein. Everybody should get that, because if that's a little elevated, greater than 1, then you start looking at harder. And then everybody absolutely needs to have pristine metabolic health, which means look at your hemoglobin A1c and look at a fasting insulin level. Those two things, very important. Hemoglobin A1c needs to be less than 5.4 ideally, and a fasting insulin less than 6. So even if your glucose looks good, but your fasting insulin levels are running at 18, you do not have stringent control of your blood glucose. So that's what I'll have people do a CGM, a continuous glucose monitor, and I'll see, because maybe their hemoglobin A1c looks fine because it's an average glucose, but every time we get these big spikes and drops, there's a surge of insulin. And that surge of insulin is what creates problems. Those people who have higher levels of insulin, I want to see what's happening, what their diet is doing with their blood glucose. So CGM can be really helpful in these patients. But everybody needs a hemoglobin A1c and a fasting insulin level, at the very least, to assess metabolic health. Next, everybody needs thyroid. Not just a TSH, but a free T3 and a free T4. And in my mind, a reverse T3 and thyroid antibodies. But again, those are not as critical. So you need to know exactly what your thyroid is doing, not just your TSH. TSH is just a marker of the pituitary. It's not telling you, is the thyroid responding appropriately? So you absolutely need to make sure that you actually get information from the thyroid, not just the pituitary. And then lastly, check hormones. Check an estradiol, a testosterone, free and total. So you need both. You need a progesterone level, both men and women. So you need to know what hormones are doing if you're going to be aging well. I like to get IGF levels, insulin like growth factor, because that gives me information about growth hormone as well. So looking at all the hormones, testosterone, estradiol, progesterone, free and total testosterone, critically important. And then also an IGF level to assess what your growth hormone is doing. We know that IGF level has a sweet spot. Too high, not good. Too low, not good. So there's a sweet spot somewhere between about 170 and 190. It's probably that sweet spot for longevity. When you're younger, higher. Those are kind of the baseline tests that I think everybody just needs. We also get a lot more. We get micronutrient profiles on people. We do clearly scans for cardiac function. We do a lot of GI testing. So those are going to be next steps. But the tests I described to you, guys, the whole panel of doing that will cost you maybe $300 if it's cash pay. You're not trying to do it through insurance. And there's a slew of information that can then tell you what's next. So I hope that's useful information. I'm going to do another post that talks a lot more about all the more fancy tests that I still think are kind of critical for longevity, but start with the basics. If you want to learn more, go to our site, go to bli.academy, and you can sign up for our Human Optimization Academy, where you can learn some of this stuff on your own, become your own healthcare provider. So I appreciate you guys' time. This is one of my pet peeves, is our kind of getting paralyzed by doing too much testing when we can get so much information from the basics. I hope that was helpful to you guys. Again, give it a thumbs up and share it. And please join our channel. Come to our Instagram at Dr. Yurth at Boulder Longevity Institute. And we hope to see more of you.